Okay, hi, I'm Dr. Tengku Putri, Resident Consultant Paediatrician from Sunway Specialist Centre, Damansara. So I'll be doing a series of videos on child health. So today's topic, I will begin with developmental milestone in children. So what are developmental milestones? Developmental milestones are an age-specific task or functional skills that a child can do by a certain age range. So in simple terms, it means that what most children can do by a certain age. So how the child moves, behaves, acts and speaks, these are all clues that will give on how your child is developing. So when you bring a child to a well visit or bring your child for vaccination, for example, the doctor will do a developmental monitoring. So the doctor will have a small chat with you as a parent on how your child is behaving at home, how your child is interacting with you at home, and also trying to have conversations with the child in the clinic and see how he or she is playing. So then doctor will see whether your child is meeting his or her developmental milestones. So what are the areas of development? The first area is the physical development, which can further be divided into gross motor and fine motor skills. Gross motor skills involve the large muscles, for example, like climbing, running, crawling, jumping, and skipping. Whereas fine motor involves the precise use of the hands and the fingers, for example, like picking up small objects or scribbling, or for example, like doing up shoelaces or using fork and spoon, right? And the second area is the cognitive and language development. Cognitive development means it's the development of the mind and how the child is reasoning, like he knows the reason of doing certain things, and also how to recognize, for example, like able to recognize certain shapes and colors, and also being to understand certain commands. Whereas speech is is the development in the communication skills, which can be further divided into expressive and receptive speech. Expressive speech means the words that the child is able to produce. Simple things like talking in single words, like it's a bird, it's a cat, it's a dog, or forming simple sentences, 2 or 3 word sentences. Receptive speech means whether the child is able to understand. For example, if you ask the child to point to certain body parts, like can you point to your eye, to your nose, to your mouth? And also if let's say you tell the child to do certain things, like can you please take this piece of paper and put it in the rubbish bin, for example. So that's an example of receptive speech. The third area is emotional and social development. Emotional development means that the child is aware of his or her own feeling and also the feeling of others. Like the child is able to express himself, show that he's angry, sad and happy, and also aware of the other person's feeling. And social development is how the child is able to interact with other people, and whether the child is able to play with other people or just play by himself, like just playing in his own world. So how do you monitor your child's development? So you need to know that a child's development vary between a person to a person. Each child is unique, and each developmental milestone has got a certain age range. For example, if let's say you have 3 children, and your eldest child starts to walk at the age of 9 months, and your third child only starts to walk at the age of 15 months, for example, you get worried. But bear in mind that these 2 scenarios are normal in a normally developing child, right? And what I can suggest is that you can download this particular app on your iOS or even your Android. It is completely free. The app is called the CDC Milestone Tracker app. I like this app because it is interactive, it is illustrative, it has checklists of your child's developmental milestone according to the age, and also they offer tips on how to encourage your child's development. Also when to act when you are concerned about your child's development. Right? And when you do have concerns, bear in mind that you need to discuss it with your child's pediatrician. What are developmental red flags? Developmental red flags are behavioral markers or developmental markers that needs to be addressed, and you need to share your concern with your doctor. There's actually a lot of developmental red flags according to various age groups, but I'm just going to share a few with you. Number 1 is if let's say the child does not respond to a loud noise by the age of 2 months. If your child is unable to walk by the age of 18 months, unable to speak any single words by the age of 18 months, unable to speak in 2-word sentences by the age of 2 years, and has problems in social interactions by the age of 3 years, not playing with others. So these are some of the developmental red flags that you need to keep an eye on. So why is it important to detect early? Is because studies have shown that early interventions by the right professional at the right time has been shown to give much better results compared to interventions being done later. For example, if let's say you do have concerns that your child has not met certain milestones or has a delay in reaching certain milestones, and in fact, if let's say your child is regressing, for example, if your child has attained certain skill and subsequently has lost that certain skill, you need to address that and share it with your doctor. And the doctor will assess and find what is the cause and subsequently refer to other professionals, for example, like speech therapy, occupational therapy, and also physiotherapy. And with all these interventions being done, hopefully the outcome will be much better. Alright, so that's the end of my video. Hope you find it beneficial, and we'll see you again in my next video. Bye!